Hello everyone and welcome to Rad Chat, founded by me, Jo McNamara.
And me, I'm Julka-Anderson. Rad Chat is a forward-thinking global knowledge hub where healthcare professionals can advance their expertise in therapeutic radiography and oncology. Unlike traditional academic resources, we blend real-world experience, expert insights, best practice and patient perspectives.
We make advanced knowledge engaging and accessible, supporting continuous learning and professional development without compromising patient care or your personal time, by providing insights into both technical skills and career development, helping you to progress confidently in your field and shape your professional future.
Just to let you know, our episodes may contain sensitive and difficult topics that you might find distressing or triggering. Please consider checking out another episode.
So, this is episode 194, which is part of the Living With and Beyond Cancer series, where we're going to be hearing from our guest Becky Robbins, talking about her experience of gamma knife treatment for a brain tumour. So, Becky, welcome.
Hi, thanks for having me.
We're so pleased to have you. Becky, we'd not met before, but I've followed you for quite a while on Instagram and was absolutely enthralled with you sharing your experience on social media. Do you want to tell us a little bit about yourself and what you do?
Yeah, sure. Okay, so I always find this question hard, so I think I'm quite boring, really. I like a quiet, peaceful life. But anyway, yeah, so I've got 3 children, Ava, Phoebe and Oliver. Oliver's 8 months old, so I'll be going back to work for maternity. It's flown by, so I'm a HR manager. I absolutely love my job. I love working with people and kind of supporting their working experience. So I feel like I have a really good kind of, work-life balance with that. Like, I don't know how anyone can be a full-time mum. I take my hat off to anyone that can do it. I can't. I like the good work-life balance. So I haven't really got many hobbies, if I'm honest, but I really, really like the outdoors. And nothing better than just going for a walk in the countryside, breathing in the fresh air with the kids. And health-wise, so I was diagnosed with rheumatoid arthritis at the age of 3, so I've kind of lived with that pretty much forever. Had hip replacements 12 years ago, so they're still going strong, they're incredible. And then obviously more recently, I was diagnosed with the Meningioma brain tumour in 2019 and recently had treatment. So that's kind of me in a nutshell. I'm really passionate about clean eating and nutrition. I've got loads to learn on the subject, but I'm really interested in how that helps and plays a role in brain health in particular.
Becky, there were so many contradictions in that where you said, I don't really do a lot. And then you said, and I've got 3 children. I think the fact that you've maybe not got a lot of hobbies is because you have 3 children.
Possibly, yeah. They do keep you busy. They're amazing. Crazy, but amazing.
Yeah, amazing. So, Becky, you kind of mentioned that you were diagnosed with a meningioma. Tell us a little bit about kind of your diagnosis. How did you even come to realise that that's what you had?
So they've called it an accidental finding because I started getting headaches, but it was at a time when I went through kind of 2 significant events, really. So I went through a divorce, which was all the events leading up to that was very traumatic. Then also had a really bizarre incident at the dentist where they injected anaesthetic in my face, in my gum. And it I don't know if it went wrong, but it froze my eyes. And they had to call the emergency dental people and everything else. So there were these 2 things, kind of big events really. And I think it was that triggered headaches. And the headaches got worse and worse. And they ended up sort of being cluster headaches. So eventually I had them all day, every day, all night, because it would wake me up as well. And they just wouldn't go. It was kind of debilitating. I mean, I was still working and obviously my mum and everything else, but it was really, really difficult to cope with. So I went to the doctors a few times and then they said, okay, especially after the dental incident, actually, they said, well, let's have a look at the MRI, just because in case there's any sort of nerve damage and things. So had the MRI scan and it was pretty much the next day or the day after. It was really quick. The GP called me and said, look, I need you to come into the surgery. It's to do with the MRI scan. And it was really early in the morning, kind of before they even open, I think it's 7:30. And I just said, you know what, I've got plans today. Can I come later in the week? Because I just, I don't know. I just went into sort of, I don't want to know mode. But they said, no, I really need you to come in. So we negotiated and I said, okay, I'll come in later today. So I had my day out and did all the plans I was doing and then went in and they said, okay, look, we found, I think they used the word mass in your head. We're not sure what it is, but we're referring you to neurology. to have a look, and you'll see a consultant, and there'll probably be more MRI scans to follow. So obviously it was just the most bizarre feeling, because you have no idea what it means. I'm not, thankfully, in this world, not been in this world before. I didn't know anybody that had a brain tumour or a mass, as they said, in their head. So it was a really surreal experience. And then there was the wait. So this, I would say, is the hardest part, because you kind of think, when they find some sort of tumour, you'd be rushed into hospital, they'd be doing everything they can straight away, but it's not like that. So, there was a long wait. I probably had 4 or 5 MRI scans in the end in total during the several months that passed until I got my diagnosis, the full diagnosis at that point. And yeah, I think that was the hardest part. Obviously, I had one daughter at that point in time, and she was, I think, about 3 or 4. And I just, I'm a really, really positive person. So I'm good at going into denial as well. I'm really positive, and I thought it will be okay. But obviously, there were moments where you think the worst, especially when you don't know what it is. So I just remember my 3-year-old at the time. She's a terrible sleeper. She always has been. She won't mind me saying that. She's nearly 10 now. But she would be in a little toddler bed, and I'd lie next to her every night. It was always the same routine, and she'd always say every 5 minutes, "Mummy, are you still there?" "Yes, I'm here." "Mummy, are you still there?" This would go on and on for like an hour every night without fail. And then one night it just hit me, and I just thought to myself, when she said, "Mummy, are you there?" And I just thought, oh my gosh, what happens if there's no answer? And that was really hard. And I thought, I don't know what I've just got to get better. I have to. So yeah. And then I went to see the consultant. So that was, as I said, about several months kind of afterwards. And he said it was a meningioma, and that they can, hopefully, they might not grow, but they can grow. And this is sat kind of right next to, or on top of my brainstem. So it was in a really tricky place. So he said, we can't operate. And it's quite small, so we'll just watch and wait. And you'll have yearly MRI scans just to check the growth. And he literally said to me at that point, go home and forget about it. So I literally took that and thought, okay, fine, that's what I'll do. So went away, and I really have forgotten about it. Just get on with life. I had 2 children in between that time and everything else. So just got on with things. So obviously fast forward to this year, and it was just such a bizarre situation. I had my MRI scan as normal, as I do every year. And then he wanted to see me, the consultant wanted to see me. And I just thought, it's probably, I haven't seen him for a couple of years now, probably just routine. And I was with my partner and also my baby, so he was little then, 4 months old or so, I think. And he just said, I'll just tell it you straight, and your tumour is growing, we're going to have to do something about it now. He went through the options, which were basically to operate or to try this radiation, the gamma knife, which I'd never heard of before. So he said operating would be extremely risky because of where it is. So we really, really want you to have this gamma knife. So obviously that was fantastic news to me that, they were going to try something else other than operating. I did say, can we wait a little while? Not do it straight away, maybe. But he just looked at the baby, looked at me and said, you need to be here for him. So we need to do something. And actually, I really appreciated that directness, because then, you don't want to ever be in a situation that you have to make any kind of decision, really, when it comes to something this huge. You want there to be a clear kind of instruction of what you need to do. So that suited me fine. And he did say, have you got any questions? And me and my partner were just, a bit dumbfounded. We just a bit speechless. So we just said no and left, and then had a bit of a cry. And then thought, okay, right, let's research this gamma knife. Come on, it's going to be okay. And then that was 17th of May this year that happened, and obviously I've already had the treatment, so it's all gone pretty quickly.
Thank you for sharing. It's quite a lot that's happened, but obviously your positivity of trying to just get on with the next steps really shines through. Were there any healthcare professional moments that you thought, yeah, this is definitely, they are definitely looking after me, on top of what the consultant did?
Definitely on the day of the gamma knife, yeah. So I went to Sheffield twice. So first to see the consultant there, and the second time, obviously, for the day itself and the treatment. So absolutely, I mean, they were just so fantastic. The consultant did ask me, okay, how much information would you like? Because I'm quite matter of fact about things. So, I wanted every detail of what could happen. So he went through the side effects and said, do you want to still listen to this? Or how much do you want? I said, everything. So, he went, and that was really helpful, just to be sort of led by me, but he, was giving all the advice and information that I needed. So that was good.
Okay, there's a lot of people out there who may have heard of radiotherapy, but may never have heard of radiosurgery. Do you mind talking us through what actually happened? What was your treatment day like?
So yeah, of course. So it was at the Royal Hallamshire Hospital in Sheffield. And the day before, actually, I had to just have a blood test. They had any woman of childbearing sort of age, they'll just test to make sure you're not pregnant. So the day itself, you get there and they pretty much immediately get that elector helmet on you. So that all happens really quickly. So I was there with 2 other women, and it's so interesting because you get talking to people, obviously, and it's amazing that, they each had something completely different to what I had, and there's just so many, a variety of tumours and different things that you just never heard of, so it's quite amazing when you start talking to people. But yeah, they get the helmet on quite quickly, and I'm not going to lie, that was obviously the worst part of the day for me, but it is fine. It is fine. I think it looks worse than it is, and I had maybe four people with me. Robin was there, and she was great. She's definitely younger than me, but she was almost like a mother figure, which I really needed in that moment, because you feel so vulnerable. It's such a bizarre situation that you just need somebody to take your hand. And she had to undo my hair because it wasn't quite right for the helmet, and she did a plait in my hair, and just little things like that just meant the world to me. But yeah, they get the helmet on. I had the local anaesthetic injections, so you have sort of 2 on the top and 2 at the back. This side was playing up. They did say, there's always one pin that's tricky. So they had to do another couple of local anaesthetics in that side. And at the time, I remember thinking, why would anyone have Botox? Why would anyone choose to have injections in their face? But they said it's definitely worse than that. But it was fine. So they put the helmet on, and what I really appreciated was they told me every little detail of what they were doing. So they said, it might make this funny sound, this might feel heavy, you'll see this, you'll hear that. So that really helped, because you just have no idea, it's all the unknowns. So that just helped me kind of just breathe and take it easy. And then they use what looked like a screwdriver, which I think I said on Instagram, to kind of screw these pins in. So it's just it's such a bizarre situation. You never expect.
It is legitimately a screwdriver.
So but once the helmet's on, once it was on, I did feel a bit overwhelmed and had a bit of a cry, but then got over that. And it's quite strange because your vision's a bit different, because the helmet sort of gives you tunnel vision. So feel a little bit disorientated, and they put you in a wheelchair just to take you back around to the main ward. And so from that point onwards, there's a lot of waiting then. So I had an MRI scan with the helmet on. So you have that first. And what I did find weird was lying my head back. It just didn't, my brain was telling me, you can't lie your head back. There's pins in the back of it. You can't do it. And so it took a good 5 minutes for them to kind of say, you can lie down. So eventually we managed that. Had the MRI scan, which obviously I'm very used to. So I always just close my eyes and I don't reopen them again until I come out. They use the contrast fluid for that too. And after that, you just wait until they get all the treatment ready, sort of thing. So, and I remember the consultant telling me, some people can be, it's usually sort of 1 to 2 hours, some people could be in for 4 hours, but they can pause the treatment if you need a pause, which is great. But my treatment was 46 minutes, so that was brilliant. And then the treatment itself is absolutely fine. You don't feel a thing. It's just like the MRI scan. Obviously it looks different to the MRI scan, but again, I just shut my eyes and didn't reopen them. They played music, so I was listening to the radio, which was good, because then I was timing every song is about 3 minutes, and then I was thinking, okay, now I think I've got half an hour to go, or whatever it was. Although at one point, I think they turned the music right down, and I thought, my hearing's gone. It's blasted my hair. That's it. I can't hear anymore. Just for a minute. I'm I can laugh about that now, but in there I was like, that was a little bit scary. but it was fine. So yeah, treatment, absolutely okay. No, you don't feel a thing. Then when you come out, they pretty much again get the helmet off you straight away, and that takes seconds. Putting it on took about half an hour, but taking it off a minute, if that. So that was easy. And then you do feel very wobbly and lightheaded, and it's all a little bit strange afterwards. I did feel really sick, actually, like that I was going to start vomiting, but I was fine. And then so that was kind of the day, and then you get discharged and you can go home. I stayed in Sheffield that same night because I live far away from Sheffield, so we stayed over. And then my baby was with me, the girls stayed at home, so because he's being breastfed, and I I couldn't breastfeed him for 24 hours, but that was just because of the contrast fluid. I thought that radiation would mean that I couldn't breastfeed, but you're not radioactive in this, are you? So it was fine after 24 hours. Even though I had actually, so when I found out I was having the treatment, I just immediately assumed I wasn't going to be able to breastfeed for a while, so I started expressing. I've got 13 litres of milk in the freezer. And I only needed. I mean,
your supply is now through the roof.
Honestly. So any breastfeeding mums, you're fine. It's 24 hours.
You be careful saying that. You'll get everyone contacting you going, have you got any spare milk?
Yeah, all the bodybuilders. Could be a side hustle. Thank you for sharing. Firstly, it's really great to hear about the therapeutic radiographers looking after you. I think that's one of the things that I love about the job is we get so much close contact and just talk you through everything. And everyone has different levels of kind of detail you want, so it's probably good that you wanted every bit of detail. I really liked what you talked about of how you coped with the treatment itself, because a lot of people who have a mask or even just any kind of other types of treatments, maybe not this one, they really struggle with their thoughts when they're going through the treatment. That's something that we hear quite a lot, that I'm on a bed by myself, I start thinking about what's been going on and stuff. So thanks for sharing that. I think it'd be really useful for other people to consider it.
Becky, was there any information that you didn't receive beforehand that you wish they'd have told you to prepare you?
To be honest, not really. I think, again, nothing really prepares you for the feeling of what it's going to be like to have that helmet on, but actually, no, I think everything was covered. And again, the appointment beforehand that I had with the consultant, he was fantastic. We spent probably over an hour with him, going through everything. And he answered every single question that I had, which was a lot at that point. So I do remember him saying, actually, that after the treatment, you will be more tired than you think you should be. And I really appreciate that, because actually you are. It's such a strange tiredness. Like, we're all tired, just, at times, if you're busy at work, when you've got kids, whatever, you know what tiredness is. And usually, I've obviously got arthritis as well, but usually I can really push through anything. I'm quite a busy person, quite energetic, and I can push through tiredness quite well. But this, no, I just couldn't. It was almost like my brain was like, no, I cannot push on. So I'd always say, just listen to your body as well, and just, if you need rest, you need rest, and that's that. And I'm very lucky. I had lots and lots of support around me with to help with the children, so I could take the time really to rest and recover well, which was amazing. But that was good advice from him, because otherwise I think I would have thought, why am I feeling like this? I should be, it's not like an operation as such, so I should be fine straight afterwards, but you're not necessarily.
You talked about, obviously, your support network, Becky. How did you find telling them about what was going on, so through all the different stages and then coming for treatment?
So my children, I didn't say anything to, other than my eldest, because she's nearly 10. I did say, I've always told her that I have a little flower in my head, which it's fine, but if it starts growing, it might make Mum's head hurt. So I sort of repeated that to her, and I said, I'm going to the hospital and they're going to fix it and they're going to stop this flower growing. So that's all she knew, and she was like, okay, cool. So which was great. It's hard telling my mum and dad, so that was difficult. And my mum is from a medical background. She was a midwife, so she's got lots of other questions, and she was there when we met the consultant to ask her questions as well. So she's seen a lot in her profession. She was a nurse before being a midwife, and in her training, so she was probably the most fearful out of everybody. My dad is Mr. Positive, so he was like, it's fine, everything's going to be fine. He's quite like me, so I'm very matter of fact, and it's going to be okay. It has to be, so therefore it will be. And then I've got a very supportive partner, Luke. So he's dad to my other two children. And yeah, so it was, you know, I think again, we had to be positive together as our family unit to say it's going to be okay because it has to be, and that was that.
So what happens now, Becky? Do you get regular follow-up? Do you have regular scans again?
So yeah, I will be having regular scans again, so just yearly scans. So the next one I think is in March. So that's also quite strange because usually when you have some sort of procedure, operation, whatever, you know, I've had 3 C-sections, hip replacements, steroid injections. You can see and feel the healing process usually, but this you just have no clue what's going on inside your head. And they did talk about, you know, it could swell up, it could stay swollen, it could go up and down in the swelling and that kind of thing. So I'm not clear of side effects until around 6 months because they can come gradual. So I'm just counting my blessings every day that, you know, right now is fine. And then I think it will be quite a while before they know if it's been successful. So there's kind of an 80% success rate, which is really high, so that's amazing. But it will obviously take time because it's a meningioma, is a slow growing tumour. So yeah, I'll have sort of yearly MRI scans again, and I guess then I will hear from them at that point.
You talked about being quite positive and thinking about your body. Have you made many changes since getting the diagnosis?
That's a good question because yes, I'm trying to you know, really think about clean eating and avoiding preservatives and additives, and I mean, I know there's a lot in the media at the moment about all that sort of thing. Going organic when I can. So yeah, so I have made a lot of changes. I mean, I self-confess massive chocoholic beforehand. And I did actually say to the consultant, so there's an 80% chance that this will be successful, the tumour will stop growing. What's the difference between the 20% and the 80%? I want to be in the 80% club. So what is it? What can I do? Is there any, you know, is it more females or males? Is it smokers, non-smokers? What is it? But he just said it's really random, you know, there's no way of knowing. But then I thought, obviously they ask you some questions before you go into the whole process, and you know, they say, are you a smoker, do you drink, what's your occupation, all the usual kind of questions, what medication are you already on. But I kind of thought, how interesting would it be if you collected a lot more data about people's lifestyles and what they're eating and drinking and what they're consuming, what they're, you know, do they live in a polluted area and all of these things, because maybe there could be some kind of pattern when you look at that. So I just thought, you know, how could, maybe it's not possible, but maybe it is, you know, if they could collect very, very, very detailed and specific questions and look for patterns. But I just want to do all I can to now give myself the best success rates possible. And maybe it's out of my control and out of my hands, but I need to do something. So this is one thing I can control and one thing I can do. And I enjoy cooking and thinking about healthy lifestyle and everything else. And obviously, as we all do, we want to provide a healthy lifestyle for our kids too. So yeah, I think that's kind of where I'm at. So it's really looking at nutrition and that sort of thing. And I've got lots to learn. I'm no expert on it at all, so I'm just trying to learn as I go, really.
Becky, I'm really intrigued now that you've kind of had this procedure, and for some people who have maybe a type of brain tumour or metastatic disease, what potentially would you say to people who are going through that but in your HR role? Because actually we have we just have a lot of people who are in the corporate world working, going through cancer, going through health conditions, and sometimes there is quite a lot of conflict between get them back into work and actually we need to make adaptations. Is there anything that you think you might take from this into your job?
Possibly, yeah, because I think obviously more understanding of what this is all about, but I think also just giving them the advice, just take one step at a time, because, you know, just treat every day as just take baby steps if you need to, but almost you don't want work really to cause more stress for that individual, because it's already a very stressful and terrifying situation, you don't want work to add to that. So I think in my role, try and do all I can to eliminate that side of things. Obviously tell them everything they need to know in terms of sick pay and what happens with all that all payroll side of things, of course, but actually just to say, we're here, come every day if you want to, but just take small steps every day and let's see where we are, and just not think too far ahead, really. That's how I like to live in the present moment anyway myself, so I try and do that as much as possible. I think it gets easier with age. I was never good at it in my 20s, but now much more so, just sort of appreciating every moment, really.
I'm going to be a bit boring and go down that HR route again. Are there different rights and things people should consider for a long-term disability, almost like with your rheumatoid arthritis, that kind of stuff, compared to a cancer diagnosis? I know you haven't had cancer, but just for people who say they maybe understand it, because obviously some people have other comorbidities or long-term conditions and then be diagnosed with cancer, or their cancer and their cancer treatment causes long-term like late effects or comorbidities. Is there stuff that people should look out for or think about?
Okay, I'm sort of in full-time mum mode at the moment, so I'll try and put my HR hat back on for a minute. I think the first thing you need to do as a HR manager is listen to their story, and to remember that no matter how approachable you are, it can be really daunting for an individual to knock on the HR office door and sit down and speak about a diagnosis or condition. And what I found actually is sometimes it can be someone's first time talking about a diagnosis out loud. And I remember when I said for the first few times, I have a brain tumour, it kind of just didn't sound right in my own head, if that makes sense, and almost felt like I was talking about someone else. So I think maybe I just have more of an appreciation for this side of it now. Secondly, it's really important they receive all the practical information they need, so the sick pay entitlements, what they need to do if they're off sick, such as supplying fit notes from their doctor, how much contact the employer would have with them while they're off, so welfare meetings, for example, and to possibly think about a phased return if appropriate too. Also, many companies do have like what's called an employee assistant programme, which is basically an employer-sponsored benefit offering free confidential support and resources for employees. So most will include face-to-face counselling sessions, for example. So I'd really encourage employees to utilise this if it's provided. And I would also encourage employers to look into these schemes if they haven't already got something like this in place. So from an employee's perspective, your employer has a duty of care to ensure you're kept safe at work and are not put at a disadvantage because of your health condition or disability. They may need to consider a doctor's report or occupational health assessment with your consent, and will probably want to conduct a risk assessment with you and discuss what reasonable adjustments can be made for you, for example. So this is all really normal stuff. What I found is many people diagnosed with a health condition for the first time will, worry about losing their job. It's a normal feeling. So I think it's just really important employees feel supported by their employers. And obviously, in an extreme case, it might not be possible for you to return to your job. For example, if you were a bus driver and you lost your eyesight entirely, obviously you can't continue in that particular role. But I think in many cases it's absolutely possible to continue working, and you are protected as well if you have a disability or long-term health condition. So if you ever did think you were being treated unfairly, then I'd always say look on the ACAS website. It's a really good sort of reference point to explain what to do in such circumstances.
How harsh of us to ask you about work whilst on maternity leave.
Oh, my head is still mush.
I thought it was brilliant. It was it came out really nicely.
Becky, for anyone listening who's maybe preparing for stereotactic radiosurgery and has maybe Googled it and thought, oh my gosh, that looks really scary, especially because the helmet is obviously screwed into the skull, what advice and support would you offer them?
It's definitely not as bad as it looks. And the helmet part is over in 30 minutes. And once you've got it on, everything's numb. So, you can't feel it then. It's fine. It feels a bit heavy. But other than that, it's absolutely okay. I would say if you can bring somebody with you, it is nice too. So, I did have my mum and my partner there with me. They can't go into the treatment room or when you're having the helmet fitted, but they were around, and that was really nice for me. And, the team also looked after them, which was so lovely. They were bringing us teas all the time and biscuits, so that was just a really nice touch. But I would just say that it's, to have an operation, it would be terrifying. I've spoke to somebody, that's had an operation for a brain tumour, and it does sound quite distressing. So it's, that's different altogether. But this, as far as the radiosurgery is concerned, it's really not as bad as it looks. And fingers crossed, you come out like this, like nothing's happened. Fingers crossed.
I suppose one thing to ask about the helmet is, has it left any scars?
No, nothing. No. So you can't wash your hair actually for 3 days afterwards. I left it maybe 5 days because I was scared. But yeah, so obviously on my Instagram you'll see that I kind of had 2 little sort of marks afterwards for a few days. But then no, it's completely disappeared. So it's absolutely fine.
And Becky, how does it feel having to go somewhere for this type of treatment? Because Numan and I do quite a lot of work with Radiotherapy UK that petition government to invest more in radiation treatments. And obviously, external beam radiotherapy isn't available everywhere in the country. There's still quite long travel times. But actually, when we look at stereotactic radiosurgery, there's even fewer machines in the NHS, and people do have to travel really long distances. What do you as a patient kind of think about the accessibility of this as a treatment?
I think for me personally, I'm very fortunate that I can get anywhere and it's easy for me to do so. So for me, when I was told that it would be in Sheffield, the consultant said to me, this is one of the very best places in the country. So for me, it didn't matter where I was going. I'd go anywhere, because just hearing that this is one of the leaders in what they're doing, I'm absolutely fine to go anywhere for it. So obviously for people less fortunate that can't necessarily travel too far and don't have the opportunity to stay over, because again, I was fortunate enough to be able to do that, then yes, maybe it would be helpful potentially for a lesser commute. But for me, it was okay.
And we're coming to the end of the episode, although we could probably talk to you all night about your experiences and ask you more HR questions. But we always end Rad Chat podcast episodes with top tips. What top tips would you give for, I don't know, healthcare professionals listening or patients listening, or anyone who just the general public who have thought, I've never heard of a meningioma, I've never heard of radiosurgery? What top tips would you give, or something that you want to leave the podcast with listeners thinking about?
I think in terms of the healthcare professionals, as I've said, what was really helpful on the day was just talking through every tiny little detail to me, so that nothing was a sudden surprise and a sudden shock. So that was really helpful. So I'd say absolutely continue to do that always. And what else? I think for patients, again, just do a bit of research beforehand. I know you shouldn't always go to Dr. Google, and that's maybe not a good idea, but just to watch videos of somebody in the helmet. That's why I did the video, just because there wasn't many videos of people in the helmet, or ones that weren't looking really grim anyway. So I thought, okay, let's kind of try and lighten the mood a bit, because it really wasn't that bad. So I think, yeah, just take a step at a time, do a little bit of research, ask all the questions you need to the consultant, and if you go home and forget questions, ring them. Ask more if you need to. Just get all the information that you feel you need. Okay, so top tip for patients. I think that firstly, the gamma knife treatment is really not as scary as it might seem. So you're in and out in one day, and the helmet might look a bit brutal, but actually it's just 30 minutes of having it fitted, and then it's over. And the rest of the day is pretty easy, or at least it was for me. And secondly, I think I'd just say to remember how incredible this treatment is. I think there's so many people that don't have the opportunity to have this treatment for whatever reason, whether it's because their condition is too far advanced, or maybe they just don't have access to it. So I know it's terrifying. I know it's a path you never think your life's going to take, but I guess as far as the treatment's concerned, try and see it as an amazing opportunity and hope for your future, because it's life-saving stuff.
Amazing top tips, and especially the HR ones. Becky didn't realise she was coming on the podcast and we were going to ask her questions about human resources. But thank you so much for doing it. I'm sure that people listening will be very grateful. So a huge thank you again to our guest Becky Robbins for talking about her experience of gamma knife treatment for brain tumour. Thank you all for listening to Rad Chat. My name's Jo McNamara and I'm joined by fellow host Julka-Anderson. Our next guest to feature will be Sonia Kumar as part of our leadership series talking about her role as a Member of Parliament for Dudley. So thank you all for listening and good night.
Well, you can use this episode as part of our free continual professional development accredited content which offers flexible learning that fits your busy schedule. Just check out the show notes for the reflective questions, links to literature and resources, and link to the completed form to receive your accredited certificate.
Stay up to date with the latest radiotherapy and oncology advancements by liking and following us on social media and hitting subscribe wherever you get your podcasts.
Please do join our supportive community designed by professionals who understand the unique challenges of working within radiotherapy and oncology. Follow us across all of our social media channels and make sure to check out our website www.radchat.co.uk. Together we're actively working to improve our profession and make a lasting positive impact on cancer care.
It goes without saying that we can't achieve this alone. It takes all of us working together to create real change. That's why we value every voice and every contribution. We ask that you listen and learn and spread the word, share your story with us and connect with us.
And if you have liked this content, why not buy us a coffee? Go to our website and drop us some love. Thank you all for listening and take care.